am Sarah Bermeo, and I'm an Associate Professor of Public Policy and Political Science in the Sanford School at Duke University. I'm the Associate Director of the Duke Center for International Development. I study international political economy with a focus on relations between industrialized and developing countries, particularly in foreign aid, migration, and trade. My co-host today is Judith Kelley, Dean of the Sanford School of Public Policy and ITT Terry Sanford Distinguished Professor of Public Policy and Professor of Political Science. Her work is focused on the importance of reputation in international relations and on human rights, democracy, human trafficking, and international election monitoring. Before introducing our guest, George Biddle, I have a few words on logistics. Our conversation today will be organized into two parts. First, focusing on the impact of COVID-19 on women and marginalized communities in developing countries for about 15 minutes, and then drawing on George's experience in development more broadly for about the same amount of time. Following that, we will open up to questions from the audience. You may submit questions via the Zoom chat function at any time, and they will be queued. You may also wish to follow our Twitter account @DukeDCID, as we will be live tweeting links to more information on the panelists and to reports mentioned in our conversation. We are pleased to welcome George Biddle, Chair of World Connect and Co-Chair of the Global Programs Committee of Women for Women International. George also serves on the board of the International Rescue Committee, where he was previously Executive Vice President from 2000 to 2015. He is a humanitarian and development expert with over 3 decades of experience in crisis response, peace building, and conflict mitigation. George, thank you for being here and a virtual welcome to Duke.
I'm very happy to be with you all, and thank you for asking me to join you and engage in this very important discussion at this moment. So thank you all. It's a pleasure.
So George, let me jump in and ask you your first question. So as a representative of these organizations, World Connect and Women to Women and the International Rescue Committee in different ways, given what's going on in the world right now, what's keeping you up at night?
Well, I mean, I think everyone obviously's first and foremost concerns are over the impact of COVID as it affects individuals' health. It's a global pandemic, and there's no question that the way in which it will find its way into every community is real, and we're seeing it here in this country. But when I put my hat on, as you said, for World Connect or the IRC or Women for Women International, obviously different parts of the world have different capacities. So issues such as extreme poverty in many parts of the world, the health infrastructure that certain societies have or don't have, government resources that can be allocated to combat a pandemic while they're facing all the other issues that developing nations or nations and societies in conflict and crisis face are obviously more daunting depending upon the individual context in which this pandemic addresses itself. You've also got in the developing world much more densely populated cities and rural areas where it's harder to do the things we're doing here, such as socially distance or have complete lockdowns. And on an economic level, of course, this is freezing up economies around the world so that people who basically have daily subsistence through their work as a laborer or as a farmer or as an income generator, those are being shut down. We're seeing this, there's a commonality in this globally right now, by the way. I do think some of the things we're seeing here in the United States are the things that are happening around the world and even in countries that we might not always associate ourselves with. So income generation, lack of education for kids, at least in school. And of course, if societies don't have technological capacity that we have, the ability to do distance learning is affected. Another major concern, which I know we're going to talk about later, is women's safety and protection in a crisis like this are affected. Their access to reproductive health care, their personal safety, both in a society as well as domestic violence. And overall, the mental health of everyone's society, and especially when you're fighting some of the challenges that either poorer nations or conflicted populations address, it just magnifies it that much more. Lastly, 2 other points I would want to make. From an NGO perspective, of course, we're worried about our funding, our business continuity, or the continuing efforts to keep our programs running. And most importantly, of course, the well-being and safety of our staff as they continue to do the work that they're doing. And then a last point I would make, and maybe we'll get into this a little later as well, is the lack of US government leadership on this from the standpoint of a global response. We didn't participate in the global meeting meeting to provide resources to address this crisis. It was one of the first times we haven't taken a lead in a donor conference. And some of the restrictions on providing PPE equipment through procurement in this country to countries that may need it abroad is a complicating factor as well in terms of thinking of this as a global community facing its first global crisis in at least in our recent memory. So those are some of the things from various
George, you're not getting much sleep these days.
There's certainly a lot going on.
Yeah, I can certainly relate to that, George. And we will get back to some of the points about women, and I'm sure also about global leadership. But let's talk a little bit about the programs and World Connect and the organizations you're working with before we go into those other points. World Connect in particular, working with marginalized populations, and tends to take an approach that's very local, focused on the local buy-in, the local approach. So can you talk a little bit about why that is a particularly apt approach right now and how that works?
Sure. One of the things that I always say when I begin to speak about World Connect is just some of the facts and figures on resources getting to local populations around the world, real grassroots efforts. It's probably less, it's around 1% of the global aid that flows from the north to the south. There are various ways to analyze this. You can look at the OECD and some other think tank analyses, but it's very little that gets directly into the hands of local actors. I think there are some perspectives that may lend themselves in the north to not thinking that that aid will be as well spent if it's done in different ways. But we believe that capacity exists everywhere in the world and that you don't always have to build it, you have to identify it and support it. We think that local solutions are sustainable. Leaders in communities know what their communities need, and developing their own essentially bespoke responses to the challenges they face, we believe is the right way to address concerns at that level. So especially in relation to the COVID pandemic, and as we also saw a bit in the Ebola crisis, not that we were deeply involved in a response, that's World Connect, but as others learned, that localizing a response, getting accurate information into the community from trusted local leaders, explaining certain responses are. So in the case of COVID, it would be hand washing and social distancing and trying to procure and find personal protective equipment. All of those can be more powerfully brought to bear through a localized response. Now that's part of a larger response that may involve national and regional actions as well, but we also believe that you have to bear down and get to those marginalized groups at the same time, because they're the ones who very often get very little aid and suffer the most as well.
So speaking of local and marginalized groups, although not a minority, women are often marginalized in developing communities. And even here in the United States, certainly we've heard reports of increases in domestic abuse, child abuse, which also affects women disproportionately in different ways. So I know that like the International Rescue Committee has been partnering with CARE, and they put out a report recently called a Global Rapid Gender Analysis for COVID. And I wonder if you could talk a little bit, George, about what they're finding and whether the patterns and the fears that we have here in the United States and other countries around the world that are really being hit by this, how are they playing out in some of these?
One of the things I want to say at the outset, as much as the pandemic is affecting all of us, and there are commonalities in terms of some of the negative effects we're seeing, every society and area of the world has its own unique challenges. So I would just want to start with that. But there are certain aspects to the role of women in society that put them in a more vulnerable position. So in the developing world, they're often the caregivers. They're the frontline responders on both a health basis and as caregiving within the house if someone's sick. So they are potentially more vulnerable to getting infected with the disease or being affected. There is the fact that their income and activities may be curtailed quicker than those of men. They may not have the same voice in their community to affect the changes that they think will be most beneficial to their families and their communities. Lastly, when a crisis like this erupts, and men's livelihoods are affected, and they are more at home and don't feel like they can provide for their family, we see a rise in domestic violence. We're seeing it in the United States, and we're seeing it globally. And lastly, when there is more of a chaos or an interruption to social services and other aspects of daily life that are considered normal, there can be an uptick in violence in the society as well. We've seen that. I was on a call with my colleagues at Women for Women the other day, and they were telling me they're seeing an uptick in violence in northeastern Nigeria outside of domestic violence exclusively. So there are various ways in which women in particular are vulnerable, and especially at this time during the COVID pandemic.
So George, talk a little bit to us then more about how the organizations you're involved with, World Connect and Women for Women International, how are they specifically working with women? What are they doing? Are they doing trainings? What are they doing?
Well, obviously every organization has its different programming priorities and different scale and reach. So, I mean, I can try and run through those three organizations for you. I mean, in terms of the IRC, which responds to crises, man-made and natural disasters around the world, and helps people to survive and rebuild their lives. They are working obviously first and foremost on the health response. They're trying to also make sure that their staff on the ground and the communities that they work with are well, as they keep their health programs, their clean water, their efforts to keep communities as healthy and safe, because they do operate we're a very large healthcare provider globally in international crises. So that's something we want to keep pushing forward. Some programs will have to take slightly back seats where where social distancing takes over. So school programs that we supported would be more complicated. We moved to digital efforts in that regard. And of course, we would want to look at ways to get accurate information and the kinds of very straightforward processes and responses that I think everyone's working on, which is clean water, hand washing, social distancing, trying to get personal protective equipment, make sure that the basic health infrastructure that exists in rural or urban environments is maintained, and that essential services as well. I mean, one of the great fallouts from this as well can be the services that we take for granted, such as support to reproductive health or vaccinations and immunization, be interrupted as well. So how do we work to do that? In the case of Women for Women, where they're working with women who have been traumatized by war and are working to rebuild their lives, cash transfers, digital communication, creating phone trees when you can't reach people digitally, making sure that when they can get together, they're reinforcing each other through village saving and loan associations, making sure that all the tools that are available to keep women strong, keep the progress they're making in their community, keep their voices heard, are magnified. In World Connect's case, where we work with local leaders in a variety of sectors, we've reached out to the network that we have, and they're coming back with local solutions to the problems they're seeing. And many of them, as I mentioned, are around the very basic responses that communities can put into effect immediately. And then others are more sophisticated around helping pregnant mothers, for instance, by getting birthing equipment out to them because they may not be able to come to a health center because of the need to address COVID, and that overtakes everything else. So there's lots of different ways that all the different NGOs are addressing this. And then, of course, there's the overlay of making sure that the organization itself can continue to function, can raise the resources it needs in the light of the economic impact of this crisis, and making sure that its own staff is well and safe, and making sure that supply lines, procurement, business practices go on. So every organization is dealing with in its own unique way, but the challenges are quite common across civil society organizations that are combating this in partnership with local communities.
Thanks, George. So before I hand it over to Sarah, I want to remind everybody to start popping your questions in for our guest, and Sarah will open up with some broader questions about international development. But I just want to ask at the end here, George, about women specifically here. How you've described an array of different efforts and the way that women are being involved. How successful do you feel this is being, and how optimistic are you that women will be able to play the role that they need to be playing in these countries?
Well, I mean, obviously, it was it's an issue that's been at the forefront of development and humanitarian actors for many years now. I think we're all working very hard to move that agenda as aggressively as possible. It requires adaptive and flexible programming. It requires resources. It requires constant monitoring. It's not one size fits all. It's a complicated, it's very hard for me to answer that and say, wow, I'm really confident that this will all go well. I mean, some of the models you look at in terms of the impact of this crisis as it relates to, let's just say, food supply and lack of adequate nutrition in societies and the concerns that the World Food Program has. Look, we see the call to food banks in our country. So we know in a very rich developed country the challenges that that people are facing whose incomes are suddenly slashed and cut out from under them. It's only exacerbated by the situation you find in the developing world, and especially if you're looking at communities that are in conflict or crisis, it's even that much more because they're already battling on so many other levels. So within that context, there are certainly many effective interventions that are being, pushed and tried throughout the world. But when a crisis like this takes over, it requires extra resources, extra thought. It means making sure that women's voices are heard as decisions are taken about what plans to put in place, what should be done for the next crisis. I mean, one of the things that, as I was speaking with one of my colleagues, they were saying, since we've got professors and students and thinkers, is how have we as a global community actually laid the groundwork for a resilient response in the face of this crisis, and what do we need to do in the future one as it relates to social, political, economic responses and preparations, frankly, to have the resilience as a global community that allows us to take this on in an effective way. I know I went off on a couple of tangents there, but it was a pretty wide question, so I thought I would take that opportunity.
George, we enjoy you taking that opportunity. Sarah.
Thanks, Judith. Thanks, George, for those comments that actually are a great segue to where we want to go, which is to broaden it out a little bit and go beyond just talking about the COVID-19 crisis as it relates to people who may be coming down with the disease and who may be suffering the consequences directly of it, and talk more broadly about the impact it's having on development programs. So World Connect, Women for Women International, and the International Rescue Committee, all of which you're associated with, work in some of the most challenging development climates in the world, countries such as Afghanistan, Haiti, South Sudan, the Democratic Republic of Congo, and many others. As organizations pivot to respond to COVID-19, there's a concern that this will come at the expense of other programming, and you alluded to this a little bit in some of your closing remarks with Judith, so I'd like to pick up on it. This worry that it will come at the expense of other programming and that pre-existing development programs might not be practical. You mentioned the impact on staff, right, during a health crisis. So how have organizations needed to change operations in response to the crisis? And what is the impact on the people who are served and on the programs that were ongoing before the virus?
Well, I think, it's hard to answer it for every organization and every situation. I think everyone is pivoting in the short term to using some of the resources that organizations and local community actors were engaged in, and actions they were engaged in, to look at what can be done to mitigate the immediate health crisis that they are facing. In today's New York Times, I didn't even have a chance to read it, but one of the major northern districts of Nigeria Kano is facing a major outbreak of COVID. So what can be done in the short term to ensure that that doesn't overtake a community in such a way that it becomes a devastating impact that's even harder to return from. So I think the fact that resources are being diverted to getting accurate information out, making sure that people understand that, washing and having access to clean water and soap. So for instance, in the case of Women for Women, or in the case of World Connect, we're using a lot of our community partners to take on those very basic tasks of making sure they're not basic in the developing world, but we think of them as that way. I mean, having enough soap, having access to clean water, having the ability to understand that social distance can change your immediate future, and making sure that clinics are then not overwhelmed. I mean, if you get into the larger aspects of what the healthcare systems in these societies can afford if people get critically ill, whether they have ventilators or ICU beds. The New York Times had some terribly scary facts on the number of those either high-tech equipment or the capacity of hospitals in countries like Somalia or Sudan, or Venezuela, where the healthcare system is completely collapsed. So the risk is profound in the short term, and I think there's a pivot to try and prevent greater devastation in the short term to societies, while you then try and repivot back with the programs that you were running previously. Of course, you're also overlaid by the fact that national and local governments have their own restrictions. So there are lockdowns, there are very strict rules in certain societies, and of course, we are bound to follow those as well. And then there are things that can be done on a larger national and international level, which is to make sure that humanitarian and development actors are not restricted as extensively, that supply chains are kept going, that there are pre-positioning of supplies, that there are ways to keep trade and cross-border activity alive, because they're critical to both economics, food provision, and keeping governments also, their financial lives are affected by economic fallout from this. So it's a kind of a reverberation from that micro to the macro and international.
Yeah, no, that's fascinating, and something that I think, all of our guests that we've had a chance to talk with so far have really talked about are the immediate implications of COVID, but then the ripple-on effects that this has, both at the local and then up to the global level. I know we hear a lot from public health experts, right? That the kind of one of the mantras out there is that in order to defeat the virus, we need to defeat it everywhere. Right? And this suggests a common struggle, but we know that baseline preparedness, as you've mentioned in some of your responses so far, right, varies significantly across the world. Access to clean water, adequate nutrition, medical services are not evenly distributed. So what are some of the most challenging obstacles to limiting the spread of COVID-19 in communities in developing countries? And is there a one-size-fits-all response that can be rolled out? And if not, how do you work right now in the local context, right? How do you tailor the response to local communities?
Well, as I say, it's not a one-size-fits-all. It's impossible. I mean, effective responses to any challenge are based on the environments, culture, setting, how other needs affect this at the same time. So there's not a simple. I don't pretend to be a health expert in my own right, but there's no question that one of the ways to obviously maintain some stability is to make sure that there is not a massive impact on the healthcare system of societies that don't have the capacity to respond. I mean, there was a terrible image just when Ecuador was hit very hard in South America, and in particular, one area, Guayaquil, large coastal city, a lot of international travel. And the whole healthcare system was overwhelmed. There were dead bodies in the streets by all accounts. We didn't read a lot about that in the United States at the time. But obviously accurate information, better planning, making sure that whatever hospital capacities exist, we're better prepped and prepared. But that requires a lot of advanced planning and resources, which I think are a little slow coming to the table to as a global community from the North to the South. And frankly, look at the North. I mean, we've had our own problems in being able to address this in our own societies. So then you get down to that granular level where you see what each situation, how each community is facing its individual situation and trying to do what you can with what you have. So basic things that are effective are making sure that there is adequate food and nutrition, which keeps people's their immune system strong, making sure that there is access to clean water and soap and the ability to clean yourself, making sure that there is accurate information, making sure that local health clinics and outposts are not overwhelmed by other factors, and try to keep the healthcare system as it exists with all the things that go on, especially immunizations, vaccinations, support to reproductive health, continue. But that requires healthy staff, adequate resources, planning and coordination with local and regional and national actors, it's a challenging undertaking. And that's just the reality. And I think everyone is doing the best they can. There is also a fear that the resources that, especially large NGOs like the IRC, whether there will be adequate funding from the international community and from the US government to support the kinds of ramped up responses to COVID in particular, while they maintain existing programs around economic empowerment and protection of vulnerable populations and education and civil society coordination and all the things that NGOs are involved with. So it's a multifaceted set of moving pieces, and there's no simple answer, unfortunately.
Yeah, I mean, it's fascinating that you mentioned both Ecuador, which had a really horrible situation, and some coverage in the U.S., some news coverage, but maybe you had to know to look for it to see it. You also mentioned, an area in Nigeria, but also that the United States in some areas has really struggled to come to terms with this. And we've also seen some reports of some developing countries that seem to be doing an okay job, right? Seem to be, responding well. And even some calls that maybe some countries in Europe and North America should be learning from things going on, in other places, places that maybe learn from the Ebola crisis or something like that, right? So, drawing on your experience working in international development, are there certain types of communities, countries, or regions that where you're most concerned about the impact of COVID-19, and why, and how can their needs be addressed?
I mean, you could literally go around the globe and explain. I mean, the most densely populated populations. I mean, for instance, I'll use an example that IRC was concerned about. As soon as we learned about an incidence of COVID in Cox's Bazar, one of the largest refugee camps in the world, of carrying, that basically is a space for the Rohingya who have fled the horrors of what occurred to them in Myanmar, and the spread of that could be catastrophic. So you look at a situation like that, that's a microcosm. But then there was an article that I was reading in the New York Times about Mumbai and the densely populated, lower income areas of major cities. You could think about, Rio to Mumbai to Mexico City. All of those are tremendously at risk at a development level. From a crisis-related level, of course, where countries like Somalia, Sudan, the Democratic Republic of Congo, and others, where their spending on health on an annual basis is minimal because their economies are not strong enough and because their governments are not as, they've been under tremendous strain for many years due to constant conflict in those societies. So the ability for them to respond at a national level is extremely weak on a good day. And when you have COVID impacting it, that's why you go down to those local levels and figure out what you can do in communities across the country, and you stitch that together. That becomes a national response. And that requires actors working in concert with one another, from NGOs working with the UN system, to local and national governments, to multilateral institutions, donors. It takes an integrated response to be able to get that right. And so I think, you could go around the world and point to certain populations that would be at tremendous risk. And of course, anything that's overlaid with war, places like Syria or Yemen, where, the hunger and famine rate in Yemen was incredible to begin with. We know the tale of suffering in Syria now, going on for almost a decade. So, those populations in particular are going to be the ones who are going to suffer tremendously, because the infrastructure and the societies provide any source of income, any kind of regular service provision in health, or even if food supplies get curtailed. And of course, then the protection factor becomes very important. How you maintain protection activities in the face of both a health crisis with the kinds of violence and chaos around you. So it's a deeply concerning. And of course, getting accurate information and maintaining data is really important, so that you can be flexible and adapt your response to how the situation evolves in any given area of a country, or a country, in its entirety.
Right, and that data point is fascinating because we've seen trouble even in the United States, right, with getting accurate real-time data for what is going on. You've alluded to it in multiple of your responses now, but I want to for the last question that I'll pose to you here, really drill down on this. We've heard, places, organizations like Oxfam or the World Food Program have been drawing attention to the development impact of COVID-19. So separately from the health impact, right? And there was an Oxfam report based on an academic study that said that we may lose a decade or more of progress in the fight against global poverty due to the pandemic. So on top of the health crisis, just the economic impact. Do you have suggestions for how to balance these two very real impacts of the virus, the impact on people's health from the virus itself, but also the impact on their economic well-being now and going forward? You've mentioned things like making sure there's enough food and making sure people have access to basic services, whether or not they are in an area that's affected by COVID. How do we balance these in communities in developing countries?
Well, I think it's also how do you balance it even here at home to a certain extent. I mean, we're seeing the tensions that arise from epidemiologists and experts on what the toll of COVID could be in a society that doesn't take these preventive measures that are having right now short-term, but could be extremely long-term negative impacts to people's livelihoods, to the economics of their communities and their societies at large, and obviously a global recession or even a depression. I do think some of the things that I've mentioned prior to this, making sure that as much as possible trade and the movement of goods and services can be kept alive as effectively as can be done in a safe way. I read something from WFP about pre-positioning and having access to depots in different parts of the world where at least food supplies could be placed in advance. I mean, we've seen the incredible growth in the distribution of food here in the United States through food banks in all parts of the country. It doesn't matter where you are, it's a critical need across the world right now. I think that also the use of, in terms of keeping information going, digital communications is going to be critical across the globe in the near term as the immediate health impact as we try and stem the immediate health impact. And then the question is, how do you pivot to regular life without slipping back into it? I don't have the perfect answer to that. I'm sorry. I mean, that one's a really a difficult and tough question. I think that the two things that I think if you were talking to Oxfam and WHO or WFP, they would say, let's try and make sure that some of the things that we have been doing don't get completely lost. So, vaccinations and immunizations are critical. Keeping trade and food supply lines going are critical. Making sure that there is high-level coordination in regions of the world so that countries can make agreements with each other about how to protect their regions of the world around trade, health, economics, et cetera. So it's a multifaceted set of tools that will need to be put to use in this regard. And of course, if there is the movement to, if there is a vaccine that is found on a sooner rather than later basis, then how that logistically is, put out across the world. Listening to epidemiologists that are hoping that vaccines will be found in multiple parts of the world simultaneously so that production can be ramped up locally, which would obviously stem the need to have one supplier sending it out across the world. So that's also part of a regional and global response to this that would be obviously a huge source of support in the near term.
Great. Well, thank you, George. We want to we've got some great questions coming in from the audience. So I'm going to turn back to Judith to pose the first one of those.
Yes, George, thank you so much for your initial thoughts. And we have some questions coming in. People keep them coming. But we have one from Sarah Hayborn, George, who also, before I ask her question, would like to point out that she says, is Mr. Biddle aware that his speech habits sound exactly like Josh from The West Wing?
I hadn't been told that before. I'll take it as a good sign.
Yeah. Sarah's question really is about sort of local context against generalized prescriptions. Some of her work is based in Somalia, and she says that many of her partners there, as in many different countries, are dependent on day-to-day incomes from activities at, say, a common market. And like you said, in some ways they're a bit like some examples we have in the United States, where you see people who just really are dependent on the economy to keep going. They need their daily work to survive. So how can we message in a consistent manner when we have these very, very varied local contexts?
Well, I think this is where, I mean, obviously, if you're talking in the context of COVID specifically, that's where adaptability and flexibility are important. What is the context that's occurring in that particular area of a country right now? I was just on a call. I'm going to use Ecuador as a comparative example because I was just speaking with 2 people on the ground in Ecuador earlier this week. And as I mentioned, Guayaquil was overrun by the COVID pandemic, but other parts of the country have not been as affected. And so in the areas where World Connect has been working in the Amazonian region with marginalized Quechua indigenous communities, we've been able to do a bit more and continue to, they've been shifting to provide support in other ways to the communities around them, accurate information, making sure when they go to the market, they socially distance, put your supplies out, if it's your fruits and vegetables, your arts and crafts, whatever else it might be, household goods, spread them out a bit more, make sure that there's a hand washing station when they come into the market, use local community leaders to counsel and support people if they're nervous and anxious from a mental health standpoint. So I think there are ways to do that. I think it then does become, and I think this is where we in the North and countries themselves and their national leadership have to be trusting of what local leaders can decide about what can be done in a community at a given time. I mean, essentially, it's also happening here in the United States where, decisions have been passed on to governors and then sometimes even to county commissioners and the others about when it's safer to open up and to collect data and monitor what's happening and provide accurate information. And I think that's what can be done in small communities in Somalia that are wanting to go to the market to sell their goods. And then of course there are ways to try and just the way, again, these commonalities, direct cash assistance from NGOs and others into communities, much in the way the US government has done it with Americans who are now out of work here, is a critical, and the fact that direct cash assistance has been really a kind of a newfound approach to helping people in the developing world. I think it's fantastic because it means you trust them to do with the resources they have what they think is the most important to help their lives rather than us deciding for them. And it's being used in humanitarian as well as in development contexts. And this is where digital and technology can come together to help in these situations. If people have smartphones, they can access cash. So, I think there are various ways to look at that, but I think it does go down to the reality of what's happening in a given part of a country at any particular moment, and relying on the local leadership there to help both develop responses in consultation with outside actors who have maybe expertise, supplies, resources, and then to educate and support their local populations to adhere to what will help them get through this.
Thanks, George. So before I launch into the next question, I just have to say, I think that this idea of giving cash directly to people, which has been on a big discussion within the broader development community for a long time. It will be interesting to see if the way that this works in the context of COVID-19 changes people's thinking about direct cash to individuals in developing countries going forward in other contexts not related to COVID-19. But now getting back to the questions from our chat, this one I think is really interesting. One of our audience members asked if there are any organizational adaptations to COVID-19 that you have been really impressed by. So anything that really sticks out.
Wow, that's a really interesting question. I'd have to think about that for a minute. Could I come back to that and give a little reflection if I have to sort of jog my memory on this one. There's nothing that springs out that someone's found, the perfect solution to a given problem.
Well, I'll follow up then, because the same person asked. It was really a 2-part question, but they weren't really related, so I separated them. Asked if you're concerned about rising xenophobia in developing countries and whether that could have an impact on the ability of foreign aid and development organizations to do their work.
Well, that's interesting. That's all about making sure that information is delivered in as objective a fashion as possible, and that rumors don't go haywire. Look, I watched, the Sunday morning news this week, and the number of harebrained ideas that are coming across the internet in this country, conspiracy theories, are affecting what's happening in our country. So it can happen anywhere. At the moment, I think the concern I've seen, more than just xenophobia, the concern that I have is authoritarian and reactionary leaders taking advantage of COVID to either cement greater political dominance and control, or to curtail services and support to potentially what they might view as actors in their society, sometimes based on ethnicity origin, but sometimes based on political belief or gender, to shut out those portions of the population that they may deem as threatening or not in their interest, or where services that were once provided were not. Reproductive health services being, and family planning services being one that women could be very adversely affected by, depending upon a given government's decision on how to deploy resources in the healthcare response. So I think that's my greater concern, but certainly we saw some xenophobia towards Chinese Americans in the United States. And it could be in any given situation where if a community felt that a foreign actor had brought the disease in, you could see a sudden surge in that. But I'm more concerned about how national governments want to use this for other means that will shrink civil society, access to services, and affect potentially minorities or marginalized groups, or in some cases women. In many cases, women potentially.
Thank you, George. We have a question from Mikhail Ben Joseph, who asks, how does COVID affect rural versus urban communities in developing countries? And how does that compare to the rural-urban scenarios we're seeing playing out here in the United States?
Well, I think, look, I mean, density of population is obviously, look, New York's the kind of the global example at this point. I mentioned Cox's Bazar because obviously refugee settings where, I mean, many displaced people now do not live in refugee camps, but refugee camps exist, and the potential for any kind of illness to spread through them is very real. So density of population, no question, has an impact. But even in rural settings, communities come together and they stay together, even though they may have large areas around them. So I do think that the risks are real, but there's no question that the outbreaks that we've seen globally have mainly occurred where there is an urban context and more people on top of one another. So in that sense, I do think it may be easier for localized responses in rural settings to move maybe more quickly than in a major urban setting where it may not just be the mayor and the governor of or whatever the structure might be in any given country, but also the national government to pay very close attention to what's happening in those urban settings, because they also can then spread not just to the countryside, but to other parts of the world as well. So I think the rural context allows you greater flexibility and, frankly, a greater ability for local actors to guide their own recovery maybe a little quicker than we'll see in urban settings.
Thanks, George. You mentioned very early on in your comments at the top of the hour a concern for lack of global leadership in response to this crisis, or at least that the U.S. is not playing the role that it has sometimes played in previous crises. And some of your questions some of your responses since then have dealt with things like keeping trade routes open, keeping supply chains going. I mean, these are all national or international level responses, right? So how do we think about crafting a response? How do you think about keeping trade open when people are worried about the borders being open because of spread of the disease? How do we think about keeping humanitarian actors moving between countries to provide services? And how do we think about some type of a set of global guidelines, or at least international guidelines, regional guidelines to facilitate this? And who should be taking the lead?
Well, this is where I think it's a multi-layered response again. I mean, there's the regional response that can occur in a part of the world where governments and their heads of state, but then other actors within, be it business leaders, civil society leaders, can play a role in a particular area of the world. But there is the need for a global response that integrates governments, the UN system, the corporate and economic forces that guide the global economy. And I don't think we've seen that to date. Obviously, historically, the United States might have been at the forefront of that, and it might have led with resources as a way to galvanize that. But that has not been the case so far in the COVID pandemic. I think you're beginning to see certain countries step up and want to say, let's do more here. There was a pledging conference, but frankly, the money's not coming through as fast as it might. There is certainly a distraction that has occurred because it is the first crisis that is affecting everyone at the same time across the world. So there is a huge distraction factor among those with greater economic or financial resources because they're focused internally, and there are political reasons for that. I mean, these are all obvious points, but I do think as perhaps some of the northern countries begin to get a better grip on their own COVID responses, and perhaps their economies begin to come back online, that it will allow a little space for them to come together with the international system as it relates to the three main areas of it, government, market, and civil society, to figure out how they're going to manage this going forward. And even if it's thinking about if there are treatments that are available or a vaccine that's developed, how is that going to be pushed out? How is it going to be distributed? How is it going to be equitable? Who's going to pay for it? I mean, I'm just thinking using that as, let's say, one example right there. But I think when you get back to things like trade routes and cross-border operations, those will really have to be done on a regional basis, you know, in the European theater, the East African theater, the South Asian theater, wherever you might want to think. And that's going to take proactive leadership on those regional leaders' behalf. I don't think anyone can come in the United States or the Secretary General of the UN or whoever it might be to tell them exactly what to do.
George, thanks. One of our listeners would like to know, you know, is there something we can learn in the other direction as well? Africa, in particular, countries in the developing world may have been facing pandemics, epidemics, more than we actually have. And so what are some, how does that affect how we approach, not sort of coming to the table as a, we have all the answers type of approach?
Well, I mean, obviously, I do think that, again, I'll refer to my conversation with my colleagues in Ecuador this week, since it's on my mind, or having just visited Nigeria at the end of January, where I had a chance to see a number of programs. I think it means there's the individual and there's the community. And, you know, making sure that as much, and I'm saying this as an American, obviously, you know, there's very much sort of individual resilience in the United States. It's the individual who has responsibility for his or her future, so to speak. But there is a community aspect, and there's social safety nets, and there's the ability to help one another. And I think in what we're seeing in the developing world, and we're seeing, of course, in the United States as well, don't get me wrong, their community response is really what is helping people get through this. If it's getting supplies to them, if it's providing extra sources of a little bit of money or nutrition or mental health as well. How do you keep people feeling that they're not, you know, losing the tether to their own survival because their income has collapsed, because they've gotten sick, because they're caring for children who might be sick. So I do think that other parts of the world that have sometimes a more communal based approach to solving a problem might be better disposed in this situation, and we can think a little bit more about that. I think we're seeing it across the United States in many communities, but I don't think we think about it necessarily on a national scale that way. And so I do think there are some lessons from that we could glean. I mean, one of the things that I think is really important in this crisis is to make sure that accurate information and data collection is being, you know, constantly updated and utilized, and that we learn from one another globally about what's working and what's not. You know, that's complicated in today's world for all the reasons we know.
Great, George. So thinking ahead, at some point, we will presumably be in either a post-COVID or at least a post-crisis COVID state of the world. Are there changes that are happening now, or that you think will happen during the response to the COVID crisis, that will affect how humanitarian assistance and relief, function in the post-COVID world? So, are there new best practices coming out, or new lessons to be learned that you think will have a lasting impact?
Well, it's interesting. I think one of the things, and I've mentioned it, is sort of how digital communication, sharing information, and how technology. I mean, look, the NGOs are already moving very rapidly on this. I mean, in speaking with Women for Women and their forces on the ground, they're using it when they don't have great access to the internet. They're using phone trees so that women stay connected and can share information. Otherwise, they are making sure that there's links digitally, and they can be communicated to digitally if they can't be seen. The same is true in the IRC's case, using, there's a partnership with Sesame Workshop to provide schooling to refugee children across the Middle East who have been affected by the Syrian war, and trying to reach kids not just through traditional mechanisms, but using laptops and tablets to be able to educate kids, deliver messages, and also help parents deal with things at the same time that they're dealing with. So I do think that, and of course, cash transfers can be done this way as well. I think that will be the next expanding element. And how does internet access become a question of rights as well? Who gets access, and how does it get to certain parts of the world? It's just like access to clean water and access to electricity. These are big issues that need to be addressed. So, I think as we think about the future, and we think about when, another pandemic might occur, or another crisis that affects the whole global community at the same time, we have to think about some of these questions in advance, and think about how we can, as a global community, come together financially, intellectually, from a common spirit and decency standpoint, to think through these questions, because it's in our own self-interest too. It may be the right moral and humane thing to do, but there's also self-interest for everyone in that at the same time, which is a good thing to mix both of those, because if it's all altruism, it doesn't always get done. So.
George, thank you. I think we have had time for one more question, and since this might be my last chance to say anything on the screen, I also just want to point out that in addition to the important roles you hold for World Connect and Women for Women International and the IRC, you also are a member of the board of the Sanford School of Public Policy, for which I'm very grateful, and help us.
I'm very proud to be a part of. Thank you very much.
And help us think about the important work that the Duke Center for International Development is doing within the Sanford School. But here's the last question that I have for you, comes from Catalina Patel. And she's asking, she's saying, here in North Carolina, we're becoming very diverse. We have people from all kinds of cultures who speak many different languages. And she's wondering whether there are any resources any of your organizations have that are multilingual that might help us overcome language barriers and communicating even within the United States here.
Well, certainly. So the International Rescue Committee, which you may or may not know, in addition to what it does globally, it also resettles refugees across 20 some odd cities in the United States, and has been doing that since World War II. And so we have been working in our communities to make sure that we take advantage of, so many different languages that are spoken, from Farsi to Pashto to you can just imagine the different numbers of languages that of the refugees that have been resettled. So there is a network there. I don't believe the IRC has an office in North Carolina, but many of the resettlement agencies they work in all 50 states, and so it would be interesting. Now that program, as you probably know from the press, has been under tremendous fire in this administration. Normally, the U.S. admits between 70 to 80,000 refugees annually. That number has come down to, I think the ceiling this year is 15 or 20, but it'll never reach that based on the processes that are in place. And frankly, since COVID, it's been, I think 2 people have been given humanitarian parole into the United States. So it's a terrible tragedy. The reverse is also happening. The IRC is reaching out to their community and trying to make sure that doctors and nurses from other societies that are here in the United States might be able to help in their communities and identify them. There's a whole licensing aspect to that that's very complicated, but they are identifying individuals that could be helpful in responding locally in this healthcare emergency. So it's kind of the reverse of not just provide, it's those people actually helping here in the U.S. But we could get that information of who's working in North Carolina and find out who's got a resettlement office in Durham or across the state that might be able to connect with your questioner.
Thank you so much, George.
Thanks. I'm going to sneak in one final question, just because I want to follow up on what you just said. Our last guest on this series was Andrew Seeley from the Migration Policy Institute, and one of the issues that he brought up was a fear by some in the refugee and asylum community that some of the restrictions that are being put on right now because of COVID-19 with regard to mobility might last beyond the crisis, right? Might be used as an excuse to keep them on. And I wonder, what your thinking on that might be, and if this is something that concerns you.
Well, there's certainly a tremendous fear. I mean, they've basically closed the borders to just about everybody. So America's traditional immigration policies, its refugee admissions policies, which are life-saving, by the way. It's probably America's greatest commitment to human rights to bring persecuted people to this country and allow them to live in safety and prosper. And by the way, refugees are enormously successful. They pay back in spades whatever tax money they've used to get them up on their feet here. And you can count millions of cases of that. There are over 3.5 million who have come here since the Refugee Act of 1980 was passed. So it would be a tremendous blow to the United States to do that. And it doesn't even speak to some of the famous refugees who have created industries like Andy Grove, who was resettled by the IRC from Hungary in 1956. So I could go on and on that. I think there is a reality that is, in fact, a possibility. And I think it can, the rationale that let's say in this case, this administration would make would be that we're protecting jobs, we're protecting people from disease, we're, all of these things, when in fact, none of that is based in fact. And the reality is that the U.S. has prospered. The labor force requires rejuvenation. We are a committed partner as a country to people who have suffered tragedy and persecution, and to throw all of that away, I think would be a tremendous loss to this country. And I think you'd find corporate leadership coming after those that might try and keep that in place. But I do think whether that becomes a major issue in the campaign that's going to really start to gain some speed over the summer will be an interesting aspect, and how people fall on either side of the aisle on that question as well. And it takes education and enthusiasm to push out countervailing points to the narrative that currently comes from some of the leadership in Washington at this moment.
Yes, I think that's right. As a matter of fact, just this morning, I believe there was a letter that was signed by a bunch of public health experts in the United States, stating that public health is not that there is no public health reason for stopping asylum at the U.S. borders, and that there are other ways to deal with the public health aspects of someone coming in. So I think you're right. The importance of education and understanding is going to be so key going forward on these difficult issues. I want to take this moment to thank you, George. George Biddle, Chair of World Connect and Co-Chair of the Global Programs Committee of Women for Women International, for an important discussion regarding the impact of COVID-19 on marginalized communities and local development. I'd also like to thank my co-host, Judith Kelley, and the communications experts at Duke Sanford and the Duke Center for International Development for making this possible. Thanks to all of you for attending online, and to those who submitted questions to enrich our conversations. Please follow us on our Twitter account for announcements regarding our next event. And until next time, goodbye.
Thank you so much.